Okay, so it's really common for people to feel some tightness or what they perceive to be tightness in that iliopsoas hip area. So there's lots of videos and techniques on ways to release the iliopsoas, right? You either do like the couch stretch, people use a kettlebell to release it. There's some really cool hook tools, lacrosse ball, some hook tools that kind of go in there that people buy. But we find that a lot of times that a component of that tightness feeling is actually part weakness, right? The two usually go together, but people are far more into trying to release their iliopsoas than they are into strengthening it. So let me first show you a test on how to determine, do you have some weakness in that iliopsoas, in that hip flexor complex? And then we'll show you a little protocol that you can do to actually strengthen it. So the test is this. The key is that you must be at the 90 degrees at the hip and then bring the hip up. Below that, if your leg's below 90 degrees, then you're getting other muscles involved that really don't test the iliopsoas as well. So the person you're testing, or if you're testing yourself, you just want to be on a box like this, and then you need to have your arms behind your back because that helps you sit up straight. Because if you don't have your arms behind your back, you can actually do it easier. Show us, Courtney, you're just like, do that sort of thing, right? So you got to sit up really straight. Then it's best if you have somebody help you, but you can take the person's leg, bring it all the way up, take your leg as high as it possibly can, try to keep it straight, and then I let go, and then you don't want it to drop at all for 10 seconds. It's harder than it looks. And we've been practicing this a little bit.
I'm a little tired.
She's already tired. She's already tired, okay? All right, so that is the test to see, like, if your leg drops at all in that 10 seconds, then you could probably use a little bit of strengthening. And the strengthening really does help relieve some of that tight feeling that you're experiencing. So the strengthening protocol involves a little bit of the test. So what I like to have people do is to bring the leg up as high as they can, really try to keep your back flat, hold it for 10 seconds, so let go, and we'll hold it, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then lower it down, right, to a 10 count. 2, 3, 4, 5, 6, okay, 9, 10. Then back, hold for 10 seconds, and then lower it down. And you're gonna do that 3 times is what I like to have people do. And it's hard. If you really hold it, we're kind of going through it kind of fast, but if you truly hold it for 10 seconds and then lower it down eccentrically for 10 seconds, it will be fatigued. I mean, you're gonna have a really hard time holding it up there. Now, if you have a little bit of hip impingement, which Courtney does, there's a little bit of lack of range of motion there, you'll see how just when she brings her leg up, it kind of turns into the side a little bit. So she doesn't have as much range going straight up. So try to keep your leg as straight as you can, but it may turn out to the side as her does a little bit. That's not too big of a deal. That's just something you need to be aware of. But do that protocol, work on strengthening the hips, and you'll find that along with the soft tissue will help get rid of that tightness feeling or that feeling that you're having in your hip. Some of that popping, clicking that goes with it too. One last thing I forgot to mention with this is when you're doing this, also just make sure you're giving yourself a little bit of like a crunch, like a little bit of a stomach contraction. And basically what that does is help lock in the spine and pelvis together and creates a little bit more of a stable base of support for that iliopsoas to anchor again. So make sure you're not just completely loose in your stomach, but locked in there a little bit better, okay? So do that protocol, see if it doesn't help with some of that tight feeling, and let us know if you have any questions.